Health officials in Gaza say that 66 children have died of malnutrition since the war began. At least 120 infants are being diagnosed each day with conditions related to acute hunger. 5,000 children between 6 months and 5 years old were treated for malnutrition in May alone. Gaza's media office says Israel's tightening siege is a war crime with the deliberate use of starvation as a weapon of war. Let's speak to Hisham in Gaza. He's the Gaza spokesperson for the International Committee of the Red Cross, also known as the ICRC, joining us live now from Deir al-Balah. Thank you for your time this morning. What can you tell us about the increasing levels of malnutrition? Because UNICEF reports that on average, 112 children a day have been admitted for treatment for nutrition in just the last 5 months.
Good morning to you, Sarah, and thank you for having me. Absolutely, there is an issue of providing food for everyone in Gaza Strip that has been prolonged for many months now since the outbreak of this horrible conflict. At the ICRC field hospital in Rafah, which includes also a maternity ward, we receive mothers who come either to deliver babies or to consult with our specialists, health specialists, and their tests are not as they should be, as healthy as they should be, as a result of the acute malnutrition that some of them, including over the course of their pregnancy period, has shown. Where we go visit hospitals, we also see babies and children, infants who are not in the health conditions they should be. They have showed less, weight measures and length and height, etc. So this is definitely impacting everyone in Gaza, including and especially children, who are the majority of this population.
And Mr. Hisham, I want to shift the focus to drinking water production facilities, because only 40% of them are still functioning. In your assessment, how acute is drinking water shortages in Gaza?
It's an alarming concern, and that's due to a number of factors. First, the water and wastewater sector in general are heavily impacted by the constant regenerated hostilities across the Gaza Strip, which have destroyed much of the networks and the grids and the infrastructure, including the water pump stations, including the desalination plants, in addition to the shortages of fuel and electricity, in addition to the hardships that the specialized teams endure on a daily basis because of the attacks, because of the restrictions, because of the evacuation orders, and attempting to reach the displaced communities and provide them with water. Fuel shortages have now become a major challenge, because it does not only impact the water trucking and the water provision, it also impacts the sewage pumping. It also impacts significantly the solid waste management. This all poses public health risks on the population that have been suffering from this conflict for a long time now. Waterborne diseases, including watery and bloody diarrhea, are showing high rates in Gaza. I cannot confirm on the numbers, but the reports are coming from the WHO, the World Health Organization, the Ministry of Health in Gaza Strip can verify this.
And can you tell us about the challenges that health facilities specifically have been facing in Gaza? Because we have seen that structural damage due to the incessant strikes that have been happening for almost 2 years now, lack of medical supplies and tools and so on. What's the situation with health facilities across the Gaza Strip?
Since the resumption of hostilities on March 18th, we haven't witnessed 1 week without a report on an incident that happened or impacted a healthcare facility, a hospital, an ambulance team, or a doctor or nurse, including those who are on duty, because they are constantly subjected to the impact of the direct hostilities. They are swamped with high surge in the casualties, mass casualty rates. And I'll give you a very simple example. Our field hospital in Rafah, which has only 60-bed capacity, has been receiving since last month a large influx of mass casualties. Most of them are injured. The vast majority of them are injured with gunshot wounds. Many of them have reported that they were attempting to reach the aid distribution sites in Rafah, and they have this situation has been not only exhausting the team's capacity, but also the hospital's capacity. For most of the days, this hospital operates at the nearly twice or double of its bed capacity, consuming its resources that are extremely limited and impacted by the restrictions on the entry of the humanitarian aid. And that is one of the most equipped hospitals in Gaza Strip that are still functional right now, and the only fully functional hospital in Rafah. That gives you an example, a stark example on how deteriorated and obliterated the healthcare system is in Gaza.
And speaking of deterioration of the health system, humanitarian organisations are warning that without the immediate entry of fuel into Gaza, life-saving services are at risk of shutting down any moment now. How acute is the fuel crisis, given that it's been so long?
According to the UN reports, Gaza requires a daily average of 45,000 liters of fuel. During the ceasefire, we have witnessed an entry of massive amounts, same like any other humanitarian aid, items and essentials. Fuels do not only supply the ambulance vehicles; they also supply the ICUs, the baby incubators, the laboratories, or whatever left of them, and they are the hardcore element for the success of any humanitarian operation. Many of them are life-saving nowadays. So, if the fuel supply is disrupted, hospitals cannot function properly, which can lead to preventable deaths. It's as simple as that.
And one of the biggest challenges is displacement of Palestinians. The UN estimates that over 684,000 people have been displaced yet again since the breakdown of the ceasefire back in March. Now, how dramatic has that situation become for Palestinians right now? Because they have no shelter, there's nowhere to go, no sanitation, and the list goes on.
It's extremely precarious how the situation has become since the eruption of the hostilities and the resumption of this conflict after the ceasefire has collapsed in last March. And we can regularly hear everywhere in Gaza, in the north, in the middle, or the south, the sound of explosions that sometimes they do not only shake, the buildings and the walls that people are taking shelter into, or the tents, or the remediatory tents that they still have left. Because they haven't, these tents have not been replaced, and they are not designed to last for that long and survive all these weather conditions in the summer and the winter. But this also disrupts functioning at hospitals, including our field hospitals. Our field hospital in Rafah has been impacted by the hostilities, the surrounding hostilities. Stray bullets every day almost are impacting this hospital, disrupting the work, jeopardizing the lives of not only the patients who are receiving medical care, but also the doctors and nurses who are saving lives there. That's from one side. The other side, other hospitals have been subject to direct impact of hostilities. Attacks on hospitals that are under international humanitarian law prohibited have made work for these teams nearly impossible at some moments. Evacuation orders are regenerated almost every week, and 80% of the total space of Gaza Strip is now is currently under or has been under the impact of evacuation orders, which jeopardizes the entire population. Everyone in Gaza feels they live in chaos, they live in despair, they don't have clarity on what is safety, which is the safe place to go and how to reach it. In addition to a daily hardship of finding the basic level of essentials, including food, including water, including healthcare. So as long as this situation continues, we will find reports of dozens of people getting killed on a daily basis, and hundreds are getting injured, with no hospitals that can absorb that huge demand.
Right. Thank you very much, Mr. Hisham Mahana from the International Committee of the Red Cross, for going through the details of the situation for Palestinians in Gaza and how horrific the situation is there.
Thank you.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.